Welcome to our latest episode of the Lebanese Physicians Podcast. And today we will be discussing sex and gender differences in nephrology with Dr. Farah Wehbe, who's an advanced nephrology fellow at the University of British Columbia and Vancouver, a beautiful area if people have not been there. And the reason I invited Dr. Wehbe is because she recently published a paper. Uh, Sex and Gender in Science, Medicine, and Nephrology, where are we and why does it matter? And we'll talk about it some more with her. Farah, welcome to the podcast.
Yeah, hi, welcome. Thank you for having me.
Of course. And so Farah, can you tell us also, one is how did you get into nephrology first, and then this advanced fellowship that you're doing?
Oh, yeah. So I finished my general medicine and internal medicine residency in the Lebanese University in Lebanon. And then during my residency, like I found myself having like passion about like how to deal with the autoimmune diseases or the GN diseases. And I was really like excited in dealing with the acid base disorders. So that's why like I applied to nephrology fellowship from this like area, and then I finished my nephrology fellowship at LAU MCRH in Beirut, and then I finished my fellowship there and came here for, and actually now I'm currently completing my second year of the advanced nephrology fellowship here at UBC, with a focus maybe on research about like the kidney care patient and the polycystic kidney disease and renal obstetrics. Yeah.
Great. And so, yeah, what years were you at LEU MCRH? I was there between 2018 and 2020, but you
Oh,
came
really?
after me,
Oh,
right?
yes. Yeah, exactly. I guess I've heard about you at some point. Yeah.
Good things or bad things?
Oh, no, definitely good things. We always heard good things about Lebanese physicians, so,
Uh, so Farah,
and I'm proud of that.
so I didn't imagine that. We don't always think you always like treat diseases. You don't necessarily think about like gender differences. Although a lot of clinical trials these days are trying to be more inclusive in terms of race, gender, and other things. So can you tell us? I didn't know there were big gender differences in kidney function. But so what are the key differences in kidney function between sexes? And how do these differences impact nephrology treatment?
Yeah, and to be honest with you, before like really delving into this paper, I didn't also like know that there was or like these really matters. So that's why like I mean, for example, there are several key differences, and I think like not all physicians realize that really, for example, men typically have larger kidneys with a larger renal cortex, glomerular mass, and larger like proximal tubules than females. Also, for example, on the other hand, the renal medulla, as we know, like it's larger in females. Also, women tend to have, for example, more expression of certain transporter in the kidneys, like the water channels and organic anion transporters. And on the other hand, if we think like about diseases, women also have a higher density of endothelin receptors and greater sodium absorption than men. So, which, if we think it's theoretically, this will increase, for example, natriuresis and the vasodilation. And maybe we'll talk more into details later on. But this, for example, like let us think that they are less risk for hypertension, for example. So these anatomical like and functional difference can really affect how disease progress and how medications are metabolized. For example, like women, we all know that they often, or like some clinicians don't actually know that they often experience more adverse events from medication due to difference in drug bioavailability, body composition, and also like volume distribution. So these biological difference like really play a role or like can make us better understand why there is a difference in the progression and disease prevalence and the overall outcome of kidney disease in each sex. So, and maybe like one thing also to mention, like for example, the estimated GFR that we all like know and we use creatinine may be less accurate in women when we compare it to cystatin C, like estimated GFR. And this is really important because sometimes it might lead to misdiagnosis of like several of the CKD or inappropriate treatment decision. Yeah.
So is the creatinine typically, it's just not accurate, but is it like necessarily lower or higher in women, I guess?
Definitely lower because of the difference that we know, like due to the body composition, like women are larger, and also because the kidneys are larger and the in men compared to women, and due to like also overall body composition, the volume distribution. So that's why, yeah.
Basically, what you're saying, just for the lay person, like somebody, if a woman has a creatinine of one and a man has a creatinine of one, the woman may have worse kidney function than the man, right?
Definitely. Yeah, exactly. That's the point.
That yeah. And are there like any hormonal like variations that affect this, or are the hormones responsible for some of this, I guess?
Yeah, so actually, the hormonal differences really play an important role in the kidney disease progression. I mean, if we like think just about the basic renal physiology or biology, we all can appreciate the difference between the distribution like of the sex hormones. So, for example, we know like the estrogen, which is more than in the females, actually in me females. So, it's thought to have a protective effect on the kidney function by influencing the vasculature and the hemodynamics, which contribute then to a slower decline in GFR among the premenopausal women compared to the postmenopausal and men. And on the other hand, like we know that testosterone is more in men, so they really play a like important role because testosterone may like accelerate kidney disease progression in men. So like those influences really highlight the importance of the factoring of these sex-specific elements when managing kidney disease, and especially like when we consider specific treatments and the strategies of patient's care.
Interesting. So one question that came to my mind now as we're talking about this, let's say if a woman is on hormone-based oral contraceptive pills for like either menopause or other reasons, would that affect kidney function?
Um, like there is no direct research about that, but it plays role like in protecting more the women. But like there is no direct role like if the like not the biological, the natural estrogen would really affect that.
Got it. Got it. And the other question I have for you is, are there gender-specific risk factors for kidney diseases that healthcare professionals should be aware of? For example, I think you told me that, for example, medications are not as well metabolized in women as in men, and sometimes they can lead to more kidney disease. So, are there other risk factors people should be aware of in these situations?
Yeah, so absolutely. There are several like sex-specific factors and complications of CKD exist. Like, for example, women are about like studies all showed more about 25 to 30% likely to have CKD than men. But like on the other hand, they don't progress quickly to kidney failure as men. And also, they don't, for example, receive dialysis. And I will talk about that in a bit, which tell us like, or raise deeper questions about the access or like a progression that really need exploring. And for example, like also other unique factors are the autoimmune diseases are more common in women. And the pregnancy related condition like the preeclampsia and eclampsia both increase the CKD risk for women. Also, like obesity, for example, is a stronger risk factor for women with a higher relative risk than men. On the other hand, like if we want to break up the chronic kidney disease causes, like the risk of diabetic kidney disease is actually quite similar between men and women. But for the hypertensive kidney, there is a higher rate of hypertension in men due to like also to lifestyle habits. So like this is really important, I guess, that we really need to appreciate. And another thing, like maybe for example, because also it's a cardiorenal in our field, for example, the thresholds of the troponin levels are really different between men and women. So the threshold for troponin is lower in women than men. And actually, now we're seeing it more within the cardiologists that they are appreciating that because, like if we take the same threshold of troponin for both sexes, we will definitely miss like ACS in women, like acute MI or like any cardiac events. So this is really like important to highlight on. And other risk factor, I guess, is smoking. Um, it's still a debate. Some studies show that it's higher impact in men and other in women. So it's still like an area of discussion. And actually, interestingly, related to nephrology, I want to like highlight also something about the SGL2 receptors. They are more common in females, but interestingly, because like we see it a lot in clinics, SGL2 inhibitors, like we all know that it's used for CKD and diabetes actually are prescribed less frequently in women, despite that the indication is similar for both. But I guess, like practically, the misconception is about the risk factor of having more urinary tract infection in women, which is not true, because all the studies show that the UTI is the same, but actually, it's about the higher risk of the mycotic genital infection in women, which actually it's manageable. So, yeah, so I guess this, for example, a risk that people are like they have fear of, which it should not be a barrier for prescribing, for example, these drugs. Yeah, and when I was writing this paper, actually, like I didn't know that, for example, also cardiovascular the function regulation also differs. Like, for example, as we know, women with hypertension, but they are more prone, for example, for AFib and for heart failure, preserved ejection fraction, while men are more likely to develop heart failure with HFrEF with reduced ejection fraction. So that was interesting for me.
So yeah, so I mean, very interesting findings. And basically, what you're saying is because women's kidneys are smaller, correct me if I'm wrong, they tend
Yeah.
to develop chronic kidney disease more frequently than men. But once men develop the chronic kidney disease, they're more likely to go towards
Progress, yeah.
dialysis and worsening kidney function much faster than women. Uh, and then for some reason, two different reasons, like women are, let's say for diabetic kidney disease, women are not treated with some of the drugs, such as the SGLT2 inhibitors, uh, which are used more frequently in men, just due to some misconceptions in that.
Yeah.
Which brings me, I guess, to a question that we should ask is how does the social and cultural context influence access to nephrology care for different genders? So, are in different countries, I guess, but in certain countries, are men more likely to get, I guess, more close monitoring and care than women, or is it the same across all countries?
Yeah, that's really interesting because I guess worldwide, like they are like there those are under recognized factors like actually the social and the cultural because I believe worldwide women like face more barriers of seeking like care or diagnosis due to several reasons. Actually, one of them, like all the studies show, because we know like the women have more caregiving responsibility, and not only like for children, but also like for their elderly. and parents. So this limit their ability to seek care. Another social and cultural context is the financial constraint and the social cultural norms that usually worldwide prioritize men's health. So, which lead to delay in seeking care and reduce access to treatment for women like dialysis or transportation. So, I guess this now, like all these studies and worldwide, they are working on more equitable, like policies and healthcare system, like they are taking these challenges into account to promote like a greater access to treatment and care and woman for woman. Yeah, actually.
Exactly. Yeah. So basically, do you think, but I don't think it's true. Do you think that the reason rates of dialysis are lower in women is because they're not dialyzed in a timely manner, or is it more like they just don't use dialysis?
Yeah, actually, you know what? This is really like an important question because, like we know, as I mentioned before, that the general CKD population between men and women, the prevalence of the impaired kidney function is quite similar. But when you look like for the at the dialysis population, yeah, men are more likely to be on dialysis for several reasons. First, because I mentioned that they progress more quickly, right? And this really like raised questions and suggest that it's either women are under-referred, which is true sometimes, and because of the delayed progression to dialysis. But another reason why we think that women are less likely to choose dialysis, because as I mentioned before, most of the time they don't have time and they are caregivers. So they prefer, for example, not to choose dialysis. And actually, which unfortunately it's true, in some countries they don't have the choice. They don't have the choice to choose. So that's why.
Okay. Yeah, yeah. That's interesting because they just don't there's not enough resources and men are prioritized for dialysis in these situations. Uh, my question for you is in different countries, especially we're both from Lebanon, I guess, how can we improve awareness and education surrounding gender differences in nephrology among healthcare providers? Because I think a lot of us like don't know that there's so many differences. And how do we improve that, especially among like primary care physicians, let's say, who are going to be the ones referring these patients to nephrologists or to kidney doctors?
Yeah, I guess the first and the most important thing is awareness. So, like enhancing awareness by integrating like sex education into the medical curriculum and like our continuing professional development. So this is like really important. So all the healthcare providers or physicians should be trained to recognize and address like the sex-specific health issues, the biases that we have, and like the communication styles. How can we do that? I guess like through workshops, seminars, and really including of the sex-focused research finding in clinical guidelines can really further support this education. And I guess the finally or last thing I can say it's through like interdisciplinary discussion, like podcasts like this, conference and research network. No, really, yeah, it really helps like to build a community of clinicians who are aware like of these differences and advocate for sex inclusive and like equitable care between both sexes.
Right. That's important. And like, are there, and I don't know, you went to medical school much closer than I did. I don't want to tell you when I finished, but but was this addressed? Were sex differences in different diseases, including kidney disease, addressed in medical school or not? I guess when you went through medical school.
Yeah, I guess the I was aware definitely that there is this difference in the kidney sizes between men and women, um, and um, like which let us know that yeah, the creatinine level is will really matter between both. But the other factors, like the really deep in the autoimmune diseases, the risk of the CKD, for example, the cardiovascular risk, I don't think also like at that time there was like enough research or clinical studies about that. So maybe that's why the reason at that time. I mean, really, I also I also graduated like a few years ago, but like medicine is really like evolving quickly. So like every month we have a new like several papers about the same topic. So medicine is really like evolving quickly. So we have info or data like every now and then. So I guess at that time we didn't also like have, or I can say there was not a lot of research awareness about that. So definitely now there's more like also awareness, and through like again more like those podcasts we're raising awareness about that, which actually really matters.
So there's a role, I guess, for research, is what you're saying, like research studies and maybe research funding, and maybe pharmaceutical companies. There's a role that they play in terms of highlighting these sex differences, and then social media, I guess, has a big role to play just because it reaches audiences much wider than a lot of other communication ways, right?
Yeah, definitely. I mean, there's are like several research gaps about that, about understanding the sex differences, mainly in medicine general and in nephrology, in particular, because like one of the biggest gaps is that women have historically been underrepresented in clinical trials, and especially if in us, like in nephrology. So that means like a lot of data that we have or we use to guide the treatment is mainly based only on male participant. So when we say like a drug works, we don't always know how well it works or how safe it is for women. So, like now, more like the clinical trials, and as you mentioned, the fund, they are raising they are working more in that to raise more fund for integrating the women and to have like just equitable percentage between men and women in research.
Yeah, and yeah, exactly. That's important. It's like more funding from government agencies, but also probably funding from pharmaceutical companies in their clinical trials, making sure that they enroll an equal number of men and women in these trials.
Yeah, and actually, it's not about also funding. It's also like raising awareness among the women to participate in clinical trials. Maybe because like in some countries there is less education among women, and like there's they need like more push or encouragement to participate, because for the reasons like I mentioned before, like they more most of the time they are caregivers, they don't have time, they choose not to participate. So also like raising awareness how this will matter. For example, you don't know, we might have like a few years sex specific guidelines, for example. It depends, like in cardiology or nephrology, we might have sex-specific guidelines. So raising awareness also with the fund among the women, like it really will make a difference.
Right. And exactly, there needs to be like sex specific guidelines, maybe even race specific guidelines, because also like different, like for example,
Yeah.
whites have different risk factors than other races. And so we have to take that into consideration too.
Yeah, and that's it. Actually, it was really for us, at least in the creatinine based, like estimated GFR, we used to use the race, whether white or black. So, like, you can't imagine, like, it's not only in nephrology, I guess, among like all specialties, but mainly in nephrology. Yeah, this really matters.
Exactly. Farah, this was great work. So what are you planning to do? This is a 1 year fellowship, right? What are you planning to do after this year?
Um,
Hard
yeah.
question, hard question.
Yeah, hard question because I'm like actively working on that. To be honest, my plan was to go back to Lebanon,
Yeah.
but and like to start my career there and like actually to help my people there. But unfortunately, like due to the situation there, I'm still not sure. So I am now like have a strong interest in renal hypertension fellowship. So I'm trying like to see if this is like um a a path I can go through. If not, hopefully I can start my career like in the Middle East or Lebanon soon.
Okay.
But we'll see what's the future hides for us.
Yeah, Farah, this was a great discussion, I think, and a very interesting article that you have written, highlighting, I guess, gender differences. And I think it's an eye-opener for a lot of us because this translates into a lot of other diseases and different specialties that people function in. So great work, and I think whatever you do, you're gonna do great. So good luck on your next steps.
Oh, thank you so much. And thank you for, I was going through your podcast like episodes lately, and I really like appreciate uh, your your initiative to highlight on the Lebanese physicians, mainly the juniors and the seniors. So great work. And thank you so much for having me.
Thank you, Farah. So, Farah, another question I have for you is what role does gender play in the prevalence and outcomes of kidney transplant patients? For example, are women as likely to get a kidney transplant? And if they do, are the outcomes as good as the outcomes for men?
Yeah, that's a really like important question to highlight on. And as I mentioned before the transplant, I was thinking like I mentioned before about the dialysis, like they are less likely to reach or to receive dialysis. And why I wanted to highlight this before because it's like a care continuum process. So when we talk about the kidney transplant, it's really like important to recognize that there is really different disparities. So, for example, women are more likely to donate kidneys, but are less likely to receive transplant compared to men. And also, interestingly, they also tend to experience longer waiting time once they are on the transplantation list. So these differences really may be influenced by several factors, such as, for example, like due to the pregnancy, they have more sensitization and higher like antibodies level. And sometimes there is a potential bias in the referral, as I mentioned before, and the evaluation process. So also, like when it comes to receiving a transplant, as we know, like if they received a transplant from a male donor, it's better than a female donor because of the reasons that we mentioned before, due to men having like high nephron mass and larger kidneys. And on the other hand, studies show that there is higher rates of rejection actually among women because of the reasons like of the high antibodies levels and sensitization.
Okay, yeah. So these are important points that you bring up. And one question I have for this, just as a follow-up, is it also could it be related to the fact that chronic kidney disease actually has slower progression in women that this is happening, or you think it's all gender related?
Actually, at the point of the transplant, it doesn't matter because when
Right.
the patients like reach a transplant, so they are end stage kidney disease, so they already progressed. So whether they are men or women, they already progressed because unless, for example, if we sometimes talk about the living donor, which sometimes like it might happen early, but whether like when it comes to transplant, it doesn't matter because both the genders or both like sexes, they already reached end stage kidney disease. So both already progressed.
Right. So basically, what you're saying is when the patients are listed for transplant, they're equal in terms of chronic kidney disease at that point in time. Yeah, that's a great point that you made. Okay, thank you, Farah.